Anish, thank you so much for giving me the opportunity. This is a great platform for me because this is where this topic is so dear to my heart and my soul. And thank you for organizing this, and thank you to Jewell for being with us today. I really appreciate, and I'm really honored to be here to be a part of this great topic. So for adult day health, I would say but this was adult day health for Seva. Adult care was started a little bit over 3 years ago, and I had seen firsthand, the challenges the seniors are going through sitting at home alone, and how their mental state and mental health goes down when they're all by themselves. And that is a lot of pressure on the caregivers, on their families at home. So the vision was just to create a place where they can get that happy and healthy atmosphere. We really bring a lot of good staff who can really take care of them. They need to be nurtured with love and care, right? So that's what the whole objective and the vision was behind opening our center. And we have seen so many success stories over the last few years because of the activities and the social interactions that they get, which they don't get at home. So it is very important part. It has become a very integrated part of the senior community, and we encourage all the seniors to come out, not sit at home. These platforms are available for them. And as I said, so many success stories. If I start that, I'll take a long time. But just the activities is one thing. Social interaction. We cater our program in such a way that we do pick them up, drop them off home. We provide nutritious meals. We do the activities like yoga, exercise, meditation, and so much fun that they can have just by making that effort, right? And that, yes, I want to go out of the house. And it really, we see so much decline in their cognitive health, so this is a great platform, and I feel really honored that we are able to provide this to our seniors.
Excellent. And Poonam, I know you mentioned before you're doing meditation, and I think that's very important. I think a lot of people sometimes take that for granted. Self-meditation is very important in addressing certain issues when it comes to your personal well-being, and kind of targeting what might be going on, internalizing what you have, that is, whether it be fears or hurdles or obstacles mentally. Doing meditation can kind of shine a light on that. So I think that's important. And I know you mentioned you also do some type of meditation as well outside that helps. Can you kind of address that and go into that further?
Yeah, absolutely. This is one of my favorite topics, and I talk about it all day. I personally had been meditating for 17 years, and bringing this, and now I'm a trained teacher as well for Sky meditation technique by Art of Living. So these techniques, we've been incorporating meditation as really part of our daily routine, yoga, exercise, breathing, meditation. And it is really, we have seen so much change in their behavior, and you see when you can calm your mind down, right, have these techniques, that is so empowering, because especially with the senior community, there is so much baggage, they are carrying with them, so much, things from the past, and there is unfortunately not much looking forward, right? They are dealing with so much at the physical level, emotional level. So these techniques, when we are incorporating that in our daily routine, we see a huge change in their overall well-being. I have seen people, I'll give you example, when we started this, there was one person. She came to me and she was in depression. For 1 week, she did not smile at all, and she was wheelchair bound. And then we started, doing these programs and activities and meditation. And she said, "You have given me another chance of life. And
Yeah.
if you will come to walk into our center any day, you will see happy faces. People are smiling, laughing. It's really, really so rewarding. And this is, I feel blessed to provide these to our seniors.
Excellent, excellent. Thank you, Poonam, for that. And once again, my name is Anish again with Azalea Homecare, and we provide these services when it comes to a home care setting. And a lot of what you say resonates to our community. We try to take care of members that are, whether it be they don't have the financial resources, we really want to provide those services to at home. And some of the issues we have on a mental health level is that many of the services provided by the state over the years of doing this are based on a physical disability. And primary diagnosis has to be a physical disability. And I think it's a discredit to a lot of individuals. They have a lot of life to live. We advocate for that. This is especially a year for us, having this discussion. I have family members that suffer from mental illness, and it drives us in a way that we really want to address how can we get to a point where we assist members in our communities at a state level, local level, where they can get the same respect and services that somebody suffering from a physical disability can get. And I think those are the challenges that we have. Some people don't realize this, but when you're assisting members at home care, there are underlying mental health issues that are going on that might not be diagnosed. And our caregivers that go out are very supportive of what's going on. And, they help from a physical aspect, from, bathing, toileting, ADLs, rehab care, but they're there as an emotional support system too. And it's very important that we give that service to them because it ensures the quality of life. And I know I can speak for Poonam and Jewell as well. We're here to support quality of life overall, and it's very key for us to do that. We really think that we want to focus on, and I know we'll get this in the Q&A, but I want to talk about how we can get to a legislative level. Who do we need to knock doors on? And I think people watching this webinar and people watching this later on, once we send this link out, are going to question that as well, because the challenges that families are facing today, honestly, shouldn't be having to face that problem of whether their mother, father, son, or daughter have to choose certain services and take a back seat on certain other avenues that might affect them, or whether they cannot get the services and then have to fight for these services through DFAC's office, or going there and not getting a clear answer. I think that's the biggest problem we have right now, and what we're facing. And I hope Jewell, you can shed some light on what our seniors can do, and especially with the mental health, and not even seniors, and this goes into a little bit further outside the boxes, our children that are suffering from autism and different across the spectrum. What can we do to support them? And overall, this is a discussion that should be had. And I know that May, we wrapped up May, which is the mental health awareness month, and to support that, some of the things that we're doing is to keep it going. And we decided to do this webinar in part near the tail end, to say mental health awareness month is not just 1 month. It should be something that we're aware for 12 months, and that's when you get impact in the community. So that's a little bit about what we do. We take care of personal care. We support our members at home. We help them with transportation to and from medical appointments. But we're also there to support them in their mental state and to give them that opportunity to be more part of the community rather than be behind closed doors and sheltered away from the community. That's incredibly important. So Jewell, I kind of want to throw that back to you and show kind of where we're coming from on the adult health side and the home care side and what challenges that you might be facing on your end or what resources that may be coming on board. But I just want to kind of open up to you and just hear from you as well.
So again, thank you all for having me this morning to have this very important conversation and hopefully a dialogue to really hit upon a lot of the points that you talked about in regards to advocacy, additional community support, public health in regards to supporting our aging population overall, as well as our personal care homes, but more importantly, looking at behavioral health overall for all individuals. So thank you for that. Again, my name is Jewell Gooding. I am the Executive Director for Mental Health America of Georgia. And we are an education, outreach, and advocacy organization. So really honing in on all of those different areas that you both have explained so beautifully well. Our different stance is that we do not provide direct services, but we advocate for those to receive direct services and ensuring that they have access to direct services. And that is a challenge across the state in regards to health insurance, in regards to brick and mortars and ensuring that people know where to go, awareness, and then looking at the older adult population. One of the things that we focus on, we have several groups that we do, and we look at the entire lifespan. So looking at pediatric all the way to geriatric and looking at advocating for behavioral health, whether that is your own personal wellness. So thank you for those mindfulness practices that you offer to your residents and letting them know how important mindfulness is, that deep breathing, meditation, general exercises that allows you to focus on something other than what's stuck inside your head, right? Because that's usually what's happening when we think about our mental health. So our goal overall is to really think about those different areas and advocate for those population and older adults particularly is important to our organization because individuals over the age of 85 have one of the highest rates of completed suicides. And often it is just kind of ignored or kind of brushed under because we're thinking we're at this end of life and, was it suicide or was it just, old age? And, the idea is that we think when we come into this world, we are attached to another individual, right? We are thriving off of others. And that social connectedness is important all the way from birth until it's our final breath. So having those social connection opportunities, engaging residents, giving them new things to do, because at any age we get bored, right? And it's oftentimes that when we get bored, we have the opportunities to go and try something new. And that's not always the case for our older populations. Having access, transportation, and just abilities to get to where you need to go. So ensuring that those accommodations are in place. So being able to create a community and create that level of social connectedness is so important for our mental health and well-being. And it is more important as we age and just thinking about where we think about different life stages, right? At birth, you're learning to trust, you're learning to really understand versus in our older age, we're looking back and we're thinking about what have I done? What have I accomplished? And a lot of that can weigh very heavily on our mental well-being. And often you see depression, you do see a lot of anxiety that's increased among that population. One, because again, who is there to support me when things are going awry? What is going to happen? And then at the state level, when you think about advocacy, right now, more than ever, we need to be advocating. With the COVID-19, our revenue shortfalls are just are huge. And what's ended up happening is that our governor is looking at cutting across all state departments about 14%. And that's a lot, when you think about a very lean government in instance is that we don't really provide that much public assistance. But what we do have, you're asking to cut even more. So looking at more of an economic downfall and just reductions in force. So you have people who are losing jobs. You have people who are going to take furloughs. You have programs that are going to be cut and decimated. And it is these vulnerable population that we advocate for the most. Older adults, the Department of Human Services that looks at the Division of Aging and supports that office and ensuring that there are access to resources. And then the Department of Behavioral Health and Developmental Disability is another public mental health sector that those who don't have insurance, or if you have Medicaid or Medicare, that they're able to provide that level of access to support. So this is one piece that we say that advocacy is important. There's the upcoming election, right? So that's one piece that we can really think about, knowing who is our leaders and who's going to allow us to make good decisions on our behalf. Our legislators that are currently going to be going into General Assembly June 11th, either 11th or the 15th. I think they're still trying to decide which one. But this is your time to contact your local legislator to have these conversations and ask them, how are you going to support elder services? How are you going to support personal care homes and other direct services that are crucial to livelihood, to functionality, and just our basic needs that are being threatened at this point? So, I mean, those are some things that we can think about in the immediate to support the work and how we can advocate for our groups.
Excellent. Yeah, and you touched base quite on quite a few of the Q&As I had, which is great, and we can kind of go in depth with that. But I think that's great, and we appreciate what you're doing, because it's time for mental health and physical health to be looked at as the same, and the stigmas to really go away. And those are the things that are challenging and have been challenging over the years and the decades, honestly. And more impact at the state level is very important. Like you said, voting is very important. We do need to get out there and make our voices heard on all social issues right now, as we see them happen day to day. We can no longer stand by and watch these things take a blind eye. And mental health is very important all across all different backgrounds and socioeconomic backgrounds as well. And those things need to be put into light. And I wanted to obviously go into what we're doing from this month onwards, and to support mental health of America, of Georgia. I haven't said it yet, but we those listening in that supported our fundraising efforts, we do appreciate you. We are more than halfway there, so far we've raised in excess of $1,500, which it's a good stride, and we want to keep those efforts coming along, because everything that you give is going to mental health of Georgia on a state level. So we really want to keep that going, and we appreciate everyone that's listening in and everyone that tunes in later on, that your efforts and even sharing the fundraiser is building awareness, and awareness goes a long way, and it doesn't necessarily have to be dollars and cents, and we understand that, but awareness is very impactful. Some of the questions I had for you on this Q&A is, what resources are available for MHA, specifically as it pertains to aging, physical disability, disabled individuals. And I know you answered and touched base on that. I think, where, is there specifics on your website? Where can people go and reach you, Jewell, or your organization? And is there specific links for as it pertains to seniors?
Well, we do provide several different types of resources, and you can actually join our website at www.mha, spelled out, .org. And we are proud to be the state affiliate for National Mental Health America, which is based out of Virginia, Alexandria, Virginia. So we connect very closely. And we do a few things. We offer mental health screenings where you can take a screening, so you can visit that on our website. We also have a landing page for COVID-19 in regards to behavioral health resources, and just outside of just mental health, but those social determinants that also impacts our mental health, right? So looking at our finances, looking at ways to socially connect, utilizing language is also important. You know, we're not social distancing, we're physical distancing, so that we can still stay socially connected. We do provide mental health awareness training as well, and we do so particularly for the aging populations when we suicide prevention. Our goals overall is to increase mental health literacy across the entire state. And when we talk about mental health literacy, it is recognizing the signs and symptoms of mental illness. It's knowing how to respond when experiencing a mental health crisis, and then being able to access resources in the community, whether it's a brick and mortar or whether it's a warm or a text line or mobile crisis. All of those opportunities still exist in the state that we want to make sure that people have access to. So our training, we do a few. We have a question, persuade, refer, which is a gateway suicide prevention planning training in order to educate those who don't have a background in mental health, but can learn to recognize those signs and symptoms of suicide. Oftentimes, even for older adults, those signs are often missed. You'll see more so when someone is having thoughts of not wanting to be here anymore. It's usually in their language and it's usually physical, right? So you're starting to see more physical challenges. You're hearing more complaints of just chronic pain day in and day out. And a lot of that is just stress. And I think what people don't recognize, one of the things we teach about is, mental health. Everyone has mental health, right? Not everyone has a mental illness. And I think sometimes it's that stigma that pushes folks to think that it's just a mental illness, when really you are looking at your mental well-being, your mental wellness to illness. It's a spectrum, just like our physical health. So really educating community providers, educating individuals, older adults, the organizations that support and serve them, so that they can start taking key notes of when they're seeing something that looks different than what the usual be for someone. When you're hearing things directly, indirectly, training does. And it's a 75-minute training that we offer. And right now, a lot of our trainings are community are grant funded, so it allows for community members to be a part of it, more about it. The other training we're doing that's kind of on pause right now just because of the COVID health crisis is mental health first aid. And mental health first aid is an 8-hour course that also teaches you how to effectively respond to someone in a mental health crisis. And we target groups that will engage with those vulnerable populations, such as first responders, 911 dispatchers, law enforcement, EMT, those who come in constant contact with individuals who may be experiencing a crisis. Recognizing that there is mobile crisis that's available, so calling 911 more than likely is going to bring about law enforcement. And what you would rather have for someone who's experiencing a behavioral health crisis is a licensed professional in order to who knows how to effectively de-escalate that. But in the meanwhile, we teach officers that, they also have that training, that they learn that process of de-escalating rather escalating someone who may already have a lot of confusion going on with their mental health. So we also offer a wellness seminar. So these are 60-minute seminars that we offer to the community, and it's taught by the community. I think one of the things that we often want to remember is that mental health is everyone. So it doesn't require a professional to understand that your mental health should be your priority, that your stress level should be managed, because when you don't manage your stress level, your body physiologically responds to that, right? Your brain goes into action and says, oh no, something's going on. It's too much. I'm overwhelmed. And now it has to release hormones and steroids in order to respond to that. So you know what happens? It got one brain. So when your brain is focused on managing your stress levels, then it can't focus on everything else. Your liver functioning, your kidney function, your heart, all of that is coming from that one brain. So in order to manage good physical health, you have to make sure that mentally you're caring for yourself, that you're really offering those different opportunities to support wellness. And that's a lot of the training that we offer to communities. And because we look at the entire lifespan, we do so specifically, like what does it look like for someone who has suicidal behavior when they are an older adult, when they don't really complain about their feelings as much, but more physical aspects that they're challenged with. And then what are some ways to respond to maybe experiencing symptoms of depression or other. But did I answer your question?
Oh, yeah, you did. Yeah, absolutely did. And I appreciate all the details on that. I think, you know,
Question, Anish, for Jewell, if you don't mind asking.
absolutely, Poonam, go ahead.
Yeah. Jewell, you mentioned that, usually typically if there is a situation at home which is out of control, you dial 911. And I think I heard you say that there is a similar helpline for behavioral health issues. Is that true?
Well, we do. It's not that quick three numbers to remember. We're working on it. That's one of our Congress focus that we're trying to advocate for a three-digit number. But right now in Georgia, we do have a statewide mobile crisis for individuals who may be experiencing behavioral health challenges. That is the Georgia Crisis and Access Line, and it is available 24/7. It is someone on the line is a licensed professional. So there's an opportunity to talk through someone, de-escalate via phone, and then if you recognize that this requires a higher level of care, then someone can be dispatched to the home in order to directly talk with that person, to de-escalate the situation, and to develop a plan in order to respond thereafter. So now that we're at a place that, yes, I want to remain here, I want to get some help, let me get you connected to some community resources that you'll have access to.
Excellent, excellent. And Jewell, just to, thank you again for answering some of these questions. And one of the last questions I had for you pertains to particular legislation that we need to get behind, particular bills that have not seen the forefront of where they should be at. And I think by talking about these particular things, we can really get out to the community and let them know that if you're having issues getting these services, which some of our members and I know Poonam and I have had challenges with this, and we discussed this the other day, that we want to try to take care of a lot of our members, and potential members are there, but what happens with that is that we can't give them those services based on the physical disability not being enough, and we can't get over the hurdle of certain insurances not being able to bill this type of arena. And that's been an extreme challenge from the get-go. And are there particular legislations or legislative bills that are being in the works, or have they pushed out anything that are we're waiting for it to get signed into action?
So, of course, we're in a very unique year. And just for those who may not be aware, our typical legislative session is from January to April. Unfortunately, of course, with the health crisis, that was abruptly ended, and session was postponed. Legislatively, the only thing that the General Assembly has to do or constitutionally they have to do is approve a balanced budget. So because the session was again abruptly ended and it will not come back into session until next week, the challenge, of course, is that there is a lot of legislation that, yes, it made it over to crossover, and that's that point where all of the different legislators are able to submit what they want to propose for legislation and then cross it over from the House of Representatives to the Senate side and vice versa. So we got through that crossover day. Unfortunately, that was right, soon thereafter they did stop the session. So there were a lot of bills that were out there that would have been extremely relevant in supporting some of that work, but more than likely, no other bills will be heard just because right now everybody is focused on the budget. So that's a lot of where advocacy efforts are going into now, advocating for unique state departments that do provide that direct care. So you're looking at, for particularly the older population, you want to follow the Department of Community Health. The Department of Community Health manages that Medicaid, Medicare reimbursement and distribution. So, and then next to that is their sister agency is the Department of Behavioral Health and Developmental Disabilities that offer those direct behavioral health services. But then you have another layer, and for the older population is that Department of Human Services. So that is where the Division of Aging sits. And where there is funding that is going to be cut in all across of those areas that will have an impact on older adults, increase access to services, approvals for Medicare services, looking at ways to ensure that there are additional workforce who can provide Medicare. Not everyone is able to bill Medicare, and sometimes that's also an issue for the older population in being able to access behavioral health care. We just don't have enough providers, right? So
Yeah.
all of those issues really tie deeply into the budget. And then the next step is the coordination of it. So one of the things I do just encourage you all, you can follow our organization. We do provide weekly advocacy updates, and we talk about some of those impacts. We talk about those sign-on letters that you can participate in. We talk about events that are being hosted to have these thoughtful conversations with our legislators, because that's where we can start. And the legislators wants to hear from their constituents. So if you live in their district, they want to hear from you more than they want to hear from me, because I represent all districts, right? But it's more meaningful because I can't vote for all of the legislators. I can only vote for those that are in my area. So if you have a voting opportunity, then that is your voice that you can utilize in engaging with your legislators now and asking them, or even talking about, these are the challenges that we're seeing. I can't get access to behavioral health services. So what are you doing about that? And there are champions in the General Assembly that supports older adults. You have Sharon Cooper, who is over the Health and Human Services Committee. She is a House of Representative, and she is strongly, and she's worked as a nurse, a strong advocate for healthcare, and recognized the importance of behavioral health care, specifically for older adults, and ensuring that they have access to all of their needs, not just behavioral health. Because we also know that when you can't get other needs met, it's going to impact your mental health overall. So I think those are some tips that we can really be able to feed to your organizations where it's more specific for elder care. There are work groups at the state level that are advocating. We can make you aware of when those groups are held and what information is dispersed there, so that we can have, it starts with the education of it. And then knowing what to do and what to say, we can offer those talking points to you. We can let you know where some of the challenges and some of the opportunities are to really have an eloquent opportunity to engage with your specific state official.
Excellent. Yeah, and I appreciate that. It's very important that people know where to go. Some people don't know where to start. And You provided some great information. Poonam, we do have the slides that you provided us, and we are going to share that out to anyone listening in right now, and then anyone listening in the future. But we will share this to the community, the slides that you provided us. There's some contact information with those as well. That's way people know where to go and how to mobilize on this topic. And it's been great talking with you, Jewell and Poonam. I think right now where we're living in with COVID, a lot of other social issues that are happening. Mental health, and is very important in addressing, I think right now, especially people of power, and figuring out how to, make sure that we are putting people in place that are in the sound mind and capable of putting down, putting in place the actions that, I guess keeping them accountable. I think that's the word right now. Accountability right now in our society is utmost important. And I know we need to do better. And I think we need to do better all across. Mental health is overshadowed, and I think we all agree that we can do more as a state. I know looking up the statistics, we rank 47th in the entire nation, and that is honestly, it's embarrassing. And we as a leading force in the South, and Georgia is, I honestly the state in the South. We should be an example to other states, and we're there. I believe we're very close to turning the state around. With a lot of the leaders that we've put in place, or the leaders that are getting close to being in power. It's just that we need to mobilize and put them over the top, because right now the last couple of decades have not been where we could, and actually the last 10 years have not been where it can be and where it should be. And I think we can all take from that and rally around people and make sure that all backgrounds are taken care of, and especially in the mental health community, we need to do better. And I think your support here, Jewell, is priceless. Poonam, you as well, ensuring seniors are having a place to go and get away, and even during this time in COVID, telehealth is important, and Poonam, I know you're doing that. And from our side, we're providing PPE to our caregivers, making sure that they're safe, and our members are safe. We are doing care packages to our members as well, to make sure that they feel that they're not left behind, and that's important for our seniors to know that there's ways for them to get the care that they deserve and that they respect, and they should get. So thank you, ladies, again, and thank you for those listening in. And Poonam, did you have anything to kind of wrap up with? Or?
Just quickly, my message for the seniors is that during this COVID-19, as you said, have that accountability. It's on you to take care of yourself. So do something where you have a routine. Get up every day, get ready, even there's nobody to see you, get ready for yourself, and just look at the mirror and smile that you are here today. And these resources, as you heard through this panel discussion today, are available. We made a choice to be in this profession, me and Anish and Jewell, so we are here to help you in whatever way we can. So at the end of this presentation, Anish is going to share our contact information and everything, and we are here to help you. And one quick message for the caregivers is that it's very challenging for the caregivers as well. So please, educate your parents what resources are available. So, and make this as a part of, be a part of the solution with us to bring these resources to them. So that's the only message I have.
Absolutely. Thank you, Poonam. Thank you, Jewell. I hope you ladies have a great day, and thank you everyone tuning in. All this information will be sent out to you, and this recording will be available soon. Take care.